China has basically stopped the spread of the coronavirus, and there are many people in the world who are interested to know how China has been dealing with this COVID-19. And some people, like America, people are sometimes suspicious or curious. So I think for China to release this comprehensive paper, I think it will help different people in the world to understand how China has been dealing with this issue.
What stood out to you the most in this report?
I think there are a lot of things. It's a very long report. It has at least 4 chapters. But for me, I'm mainly looking at the international cooperation issue. It is saying that China has sent at least 27 medical expert teams to at least 25 different countries, and China is working with 150 countries globally to help them know what can be helped by China to deal with this issue.
And some of the report was also a rebuke to the criticisms, mainly from some in the U.S., that China mishandled the coronavirus outbreak, that it did so negligently, or some suggested intentionally. Do you think the paper goes far enough to refute those suggestions?
I think some people in the United States will still be critic to China's effort, but this paper has tried its level best to tell the world that how China has been communicating with America and the World Health Organization. It is saying that I think generally China started to share all the information on this issue with World Health Organization, and China's chief of CDC was talking to U.S. CDC on January 4th. It is a long time ago, before President Trump and the U.S. administration has realized the gravity of this coronavirus. And I think those people in America, many of them will start to understand how China has been successful in dealing with this issue.
Dr. Bruce Aylward, the Canadian epidemiologist who led the WHO mission to Wuhan in February, he said that if he contracted the virus, he'd want to be treated in a Chinese hospital. Quite strong sentiments there. Do you think sentiments like these are getting buried internationally?
I think many people around the world will more understand what China has done to control this situation, and I think that this Canadian expert was correct. China has left nothing behind. It has mobilized every source they can use to deal with this issue. We can see this mobile cabin hospitals. We can see all the hospitals, all the experts and the doctors coming from different provinces to help Wuhan and the Hubei province, those infected people. So I think China has tried its level best. So I think this doctor has a reason to believe that he would rather choose to stay in China if he gets infected.
In this white paper, China says it now has around a 94% recovery rate for COVID-19. Can other countries emulate this? I think it will be complicated. I think some developing countries who are having very limited medical resource, some however, like United States, they are having many very different systems, and people here in America don't care too much, so they just came out. So it may be difficult for some countries, but for a lot of countries, especially developing countries, I think there are at least a few experiences they can learn from China, like to establish mobile cabin hospitals, to use mobile phones, those apps to track infected cases, and to have travel restrictions to those areas who is the focus of this coronavirus, and also face a very careful reopening of the society. I think that those things can be learned without
a lot of difficulties by developing countries.
Zhang from Shanghai Wen Hui Daily, thank you so much for joining us.
Thank you.